national state of disaster was prolonged on Monday in what is believed to be the last extension for the lockdown framework. The extension will lapse on the 15th of March. But COGTA Minister Dr. Nkosazana Dlamini-Zuma has aired some of her concerns. To discuss this, we're joined by Veronice Ueckerman, who is the Adjunct Professor of Internal Medicine at the University of Pretoria and convener of the Progressive Health Forum, Dr. Aslam Dasoo. Good evening to both of you, and thank you so much for your time. Professor Ueckerman, let me begin with you. This conversation has been taking place for some time, and the President in his State of the Nation address talked about the need to make some legislative changes before they could bring an end to the state of disaster. Are you getting a sense that that is happening at the pace that it needs to?
Hi, good evening, Kathy, and all your viewers, and thanks for the opportunity. So, I think we're at a somewhat of a dramatic pause at the moment, aren't we? We're not quite sure what's going to happen. We do know that restrictions do need to ease and we need to get out of this state of disaster, but I think it would be a gradual process. I think there are conflicting parties in this as well. I mean, we have to weigh the risks of our vulnerable population. We have a lot of vulnerable people and we have a lot of unvaccinated people still, versus the need to really move forward. So I think we're all sitting with bated breaths, holding our breaths to try and see what is going to happen in the weeks to follow. We've seen some easing around contact tracing, for instance, in asymptomatic cases, but it's very difficult decisions that are to follow.
Dr. Dasoo, the health department has said a lot of the changes around the legislation that needs to be changed is to allow the kind of quick responses that the state of disaster allows them, to put in place should we have a sudden peak. When you look at the lessons that we've learned over the last couple of years and where we should be, would it be as dramatic as it was when we had the first wave, the kind of changes and rollout to infrastructure that needs to happen?
Good evening, Kathy. Good evening to Professor Ueckerman and the viewers. I think the situation is vastly different now than it was when this entire state of disaster was put into place. And one must understand that this Disaster Management Act is designed really to deal urgently with a national, unnatural or natural disaster so that resources can be quickly deployed. It wasn't meant to manage a multi-year pandemic. And we have heard and we have seen the damage that unthinking restrictions have caused, despite pointing these out. And the important fact is that in the approach taken by the government, many interests are put in determining, what restrictions should come into play. And what we found was that even the very well-considered health advice was relegated to other interests. So it's been an exercise in great frustration for most people. It has caused a lot of damage. Granted, when the pandemic began, we didn't know much about it, and one could have expected a severe restrictive approach. But it became pretty clear quickly that was not necessary. However, we are where we are now, and there's no point in pushing against an open door, because the President has said that we will move out of this restrictive phase. But, it's got to go beyond the department making excuses. We need legislation for this and legislation for that. Existing statutes, powers given to the President, to the Cabinet, to the Department of Health, we believe are sufficient, certainly at this stage of the pandemic, to manage any exigencies that could arise. And should there be one that goes beyond the capability of what we have in place, it's easy enough to put something in place. We did it, exactly that, at the start of the pandemic, and we could do it again. It's not expected that we will have such exigencies, so I don't understand all this prevarication. They must rescind this Disaster Management Act immediately. There's no need to to keep it in place.
Professor Ueckerman, when we talk about the gaps then in legislation, you heard Dr. Dasoo saying he believes that there is sufficient legislation in place. But if you are to reflect on the gaps that could exist, what are some of those that would come to mind?
Well, I think just at the moment, I'm obviously in the health sector itself. So even in just how we interpret what has been legislated now regarding context to the hospital setting, there's a bit of a gap for us. I think there's a lot of clarity needed. There seems to be this polarized idea that we're going to go from all to nothing, which I don't think is how we should approach things. But there are a lot of gaps in understanding how exactly we're going to phase this out in the healthcare level. You know, what that means for the patient in front of us in terms of isolation, pre-testing, contact of people who present to our emergency departments, etc. So that's where my focus certainly is in the health sector and interpreting legislation in that context. But as you know, we've just been speaking about, it seems, you know, we know that the way forward is that the state of disaster will end. And I think there's just a clarity needed around what exactly that involves. And certainly as a healthcare worker, I'm not certain exactly what that would involve for my patients.
And in terms of confusion that you're talking about, where does that confusion lie, Professor Ueckerman? Because as you know, clients on the other, or patients on the other end of the spectrum, we perhaps might not see what those challenges might be.
As I mentioned before, I think we're constantly weighing up the risk of moving very rapidly to what people, I think the general public, are looking for normality. We're looking for returning to life the way it was before the pandemic. And however, we know we are facing another wave, and we're not quite sure what that wave will involve. So certainly, yes, we've learned a lot since we started the pandemic, and a lot of the regulations we know were not in keeping with science necessarily, but we have the science now. We know what works and what doesn't work, and we just need the legislation to align with that. I think that is really what we're looking for.
Dr. Dasoo, let me give you the last word here.
Sure. I mean, I agree exactly with what Professor Ueckerman said. Listen, we've learned in 2 years more than we've learned about any other disease on the planet in the shortest possible time, and what to do about it. What we've also learned is that there has been an overreach by the government, and this is not only in our country. We've seen this happen around the world, and the problem here is that we can't measure the impact of those restrictions except when we see unemployment figures, going up and GDP going down. But their direct effect on mitigating the pandemic, we don't know. So I'll make this call. We need a thoroughgoing inquiry into the pandemic and our response to it. This is not a witch hunt. This is a very necessary scientific endeavor to ensure that we have the basis for a plan for the next pandemic. And the next pandemic will come. We know this. And so if we lose this opportunity, let this crisis go to waste, it will be terrible. And I think the state of disaster management, the state of disaster should be rescinded. There's really nothing compelling us to keep any of it in place. Of course, we need to up vaccination, especially for the vulnerable people, to protect the health system. We've always known that, and we must still go ahead with that. And the recent news that the department may be downscaling its prioritization of vaccination is deeply distressing. So that's a real worry. But in terms of the country knowing now how to behave during the pandemic, we've made great strides. I think masking will still be a feature, which is not necessarily a bad thing because it stops other illnesses also from being spread if you're infected. So it's a good habit to have. But I think other than that, we should allow the country to be able to function well and to let people get out of this restriction that has damaged their incomes, damaged their social lives, and damaged society as a whole. Time to move on.
Let's leave it there for tonight. Professor Veronice Ueckerman and Dr. Aslam Dasoo.